Hi, my name is Dr. Daniel Ebule, the Chief Executive Officer of Rejoignez Nigeria, and I'll be speaking on the psychosocial needs of persons affected by leprosy. The psychosocial needs of persons affected by leprosy include emotional support to overcome the stigma, discrimination, and social rejection that they face due to the disease, as well as interventions to build their self-esteem and improve their self-reliance in the face of the psychological challenges occasioned by the disease. They also require community and economic integration through inclusion, awareness, and rehabilitation programs. Some of the common psychosocial needs that persons affected by leprosy require include emotional needs, social needs, psychological needs, practical needs, and even spiritual needs. I'll be taking them one by one to explain why they need those. For the emotional needs, top on the list of what affects persons affected by leprosy is stigma and discrimination, with social exclusion often suffered by persons affected by leprosy, stigma, discrimination leading to feelings of shame, guilt, and sometimes even low self-esteem. Of course, following the stigma and discrimination comes the feeling of anxiety and even depression, which can follow the impact of the disease to persons affected by it, leading to even post-traumatic stress disorders. And then there's a fear of abandonment. Of course, patients or persons affected by leprosy actually fear, and they have a right to do so, fear being abandoned by family and friends due to the stigma and discrimination associated with leprosy. For the social needs, persons affected by leprosy may suffer social exclusion from immediate social circles, including their immediate family. And sometimes, due to the physical disability they suffer from the disease, may also be excluded from participating in family events. Now, leprosy also brings about a loss of livelihood as it affects the ability to work. Of course, they may also suffer some kind of stigma leading to loss of livelihood. They may be asked to stay away from work, and they may lose their primary source of income if they are self-employed due to the discrimination that leprosy brings. And family and relationship issues also suffer greatly, as mentioned earlier, leading to marital issues, families dividing, friends abandoning friends, and all of that. The psychological needs. Persons affected by leprosy would require coping mechanisms to deal with the emotional and psychological impact of leprosy, including the depression and anxiety that it brings to them. They need psychological support to improve their self-esteem and confidence because of the impact of the social stigma and discrimination they may face, and of course the impact of the disease itself. And they also often require strong mental support, including counseling and therapy, continuous counseling and therapy to help deal with the disease. Of course, because of the condition, wound sores and the rest, they require access to healthcare. So they may require assistance in accessing healthcare services, including diagnosis, treatment, and rehabilitation. They also require economic support to cope with the loss of livelihoods. And this may come in the form of financial assistance, grants, or vocational training where available. They may require support for accessibility and mobility due to loss of limbs or destabilization. And this may come in form of the need for prosthetic limbs and wheelchairs. For spiritual needs, we're in an African setting, and we also know that patients may require spiritual support, including counseling and prayers, to help cope with the situation. They may also need to find meaning and purpose in their lives despite their situation. This is where counseling also comes in. And of course, they may need support to maintain hope and resilience in the face of adversity. Our slogan for Rejoignez Nigeria this 2025 is Zero Stigma. And we hope that we will use the opportunity to fight all forms of stigma and discrimination against persons affected by leprosy, NTDs, and of course any other disease, We hope that with our collaboration with our partners and friends, we continue to sensitize the entire public to fight stigma, shun stigma and discrimination, and embrace and show love to persons affected by leprosy. Thank you.